Hello. My name's Andrew Dayani. I'm the Medical Director here at Somerset Partnership. I come from a slightly unusual background in a community and mental health trust, in that my background is 19 years as a GP. I've been here with the trust for just over 2 years, initially as Deputy Medical Director, but more recently as Medical Director. This particular project that we're recruiting to relates to our Tier 4 inpatient CAMS unit, which is called Wessex House and is located here in Bridgewater. We unfortunately had to close it around 18 months ago, and the reason for that was safety concerns due to lack of staffing. And the Trust took the decision that rather than wait for an event to happen, we would close the unit until we could satisfactorily staff it, but also put in place the leadership that was required for the Trust to be secure and assured that the unit was functional and safe, which for us are the most important things about any of the services that we run. Where are we now? Well, we have funding from NHS England to reopen the unit, and we're planning to do that in the very near future. What my role as the Medical Director is with the reopening is obviously to recruit somebody of sufficient calibre, vision and experience to be able to run the new unit. And I'd like to talk about my particular view of what this new unit should be and what reopening means to me. Wessex House was closed 18 months ago. For me, this is not about just reopening. I don't see that reopening and reinstating where we were 18 months ago is good enough. I am really committed to building the new unit, both for the people of Somerset who currently have no inpatient Tier 4s unit, but particularly for the South West, that this grows to be the beacon centre for excellence in CAMS. I feel that we got to a position previously where, due to safety concerns, we had to close, but now this is more than reopening. This is really about stamping our mark on the future of children's services and making sure that they're good enough, not just for now, but for the future, and that the problems that we've had with recruitment never occur again, because this is seen as the place to work. In order to do that, I need somebody who shares that vision, has the ability to grow both themselves in terms of their development, but also the people around them, and to place their mark on the future. This is, to me, it's the ultimate CAMS unit that we wish to grow, and I hope that you will be part of that. The immediate priority is to reopen the unit. It goes without saying that within the UK there is an absolute shortage of Tier 4 CAMS beds, and pressure both within government and from the public is to expand the number of Tier 4's beds. So we need to get the unit open, but we need to do it in such a way that we don't compromise safety and we don't reinvent some of the problems that we had before. What I particularly would like to do is taper the opening, so that we start with a small number of beds, probably around 6 beds, but grow to 12 initially, and then develop from there. The reason for doing this is that within a small unit, if you have less than 6 beds, the likelihood is that you have excess staff. Attentions aren't trained on ensuring that the patients are looked after properly. But similarly, if we have more than that initially, you don't have the ability to grow your team. So this is to give capacity for growth, but at the same time make sure that we're still concentrating on patient delivery, which is obviously what is at the heart of all of our services. And in this particularly vulnerable group, we want to make sure that they are not only cared for, but are treated so that they go out of the service better than they came in. Short-term priorities my intention is that this becomes a beacon centre, both in terms of the standard and quality of care that it delivers, but also in terms of the innovation and research that it offers, both to the development of staff, but also in terms of looking at the treatment for young people. We in Somerset have an unusual circumstance in that we have a very large area that we cater for, and this particular unit will be the only one within that large geographical area. What that gives us the ability to do, as well as obviously is a slight problem in terms of the distance travelled, but it gives us the opportunity to innovate about combined inpatient and community care. And so I'm looking for somebody who will not just reinstate a model that they've seen elsewhere, but is looking to innovate and to trial with our patients new ways of delivering services. And that's the opportunity that you have. Although this won't be an absolute clean slate, you do have the backing of both the board and the executive team to develop this service so that it does become the pinnacle and the primary CAMS inpatient unit and indeed CAMS service across both the county and the southwest, and ultimately I would hope the country. So what that requires is somebody with vision, but also who is prepared to take risk, not clinically exactly, but risk in terms of trying something new that may never have been done before, but have balanced that against the evidence and their abilities and the support of their team to deliver safe services. As keeps being repeated, safety is our primacy, but we also want to innovate, and we're looking for people who will do that and take us forward. And I have to say that there's a degree of self-interest here as well as just for CAMS. I think that if we bring the right person in to our team who can innovate, it not only brings along children and adolescent services, but the entire organisation will benefit from it. And that's something that I want to invest in for our long-term future. We are a small organisation at the moment, but we do have big ideas, and we want somebody with those similar big ideas who will grow them and work with us. So I hope that appeals to you. I moved to Somerset 20 years ago, and I have to say that I have absolutely no regrets about moving to the county. Somerset is a county of contrasts. It's very rural, but it has Exmoor, it has the hills, both the Mendips and the Quantocks, and it has the coast. You're in easy reach of some of the most beautiful beaches in the country in South Devon, and you've got the ravages of Dartmoor and Exmoor for solitude if you feel the need. In addition to that, you have some of the most beautiful and interesting venues for external events in the form of the Glastonbury Festival, which takes place each year and brings in the best of music performers. But not only that, Somerset is in easy reach of Bath and Bristol, which both have literary and arts festivals that rival some of the best in the country. But the quality of life here is something that appeals to most people who come. That there is a pace to the way of life that is relaxed, but don't let that fool you into thinking that Somerset is a sleepy backwater. Some of the major innovations that have occurred in both healthcare and in technology occur here in Somerset. On the innovations front, you have Westland Augusta, leading helicopter manufacturers in the country, and other technology occurs around here that would surprise you. In Somerset you have DES, Data Encryption Services, who design encryption microcircuitry that's in most mobile phones. this attracts some of the leading technological and healthcare professionals in the country, and with good reason. You can balance that sharp edge of academic stimulus with a fantastic quality of life. And should you wish to disappear from the county, you can do so quite easily. We have fantastic rail links, good motorway networks. You're on the doorstep of the M5, and you've got Exeter and Bristol airports within easy reach. Even Heathrow and London are less than 2 hours away, in fact less than an hour and a half really. You know, never mind the getting away. There's a lot to encourage you to Somerset. The people are friendly. The people in Somerset Partnership in particular are highly committed, very friendly, and are really interested in developing ourselves as a trust, but also the CAMS service, which, you know, we are deeply committed to. I hope that what I've told you encourages you to apply. I'm certainly very happy to take any questions that you want to send to me, and I would urge you to at least look into it. Thank you very much for your time.